See You Now is a podcast highlighting the innovative and human-centered solutions that nurses are coming up with to solve for today's most challenging healthcare problems. Created in collaboration with Johnson & Johnson and the American Nurses Association, and hosted by nurse economist and health tech specialist, Shauna Butler.
We have nearly 500,000 kids in foster care in any given year. Overwhelmingly, the majority of foster youth are under 10 years old. The most common reason they go into foster care is neglect. The kids are not okay. They are depressed and they are anxious and they are on edge because they're in this environment that is very unpredictable. I think sometimes as nurses, we don't always connect our role as a nurse with the foster care system. We look at all these other vulnerable populations, but I feel like our foster youth sort of get ignored. We can learn a lot from the power of connection, of community, of empowering parents who are really struggling and trying to keep the families together. And that will help address the mental health needs of the kids.
Hey, See You Now listeners, Shauna Butler here. So, just checking in. How's everybody doing? That was the message posted on a random Monday on social media by one of Sesame Street's beloved Muppets, Elmo. A rather kind-hearted check on his friends around the world. Well, much to his surprise and some 200 million views, comments, images, and emojis 24 hours later, what Elmo learned was, we're not okay. The widespread engagement with Elmo's post comes during a growing mental health crisis affecting millions across the world, particularly our children. And nowhere does mental health hit harder than for children in foster care. The American Academy of Pediatrics highlights that mental and behavioral health is the largest unmet health need for children and teens in foster care. During May, when we celebrate mothers and nurses and graduations and mental health, it's also the month when we turn our national awareness to foster care and the 500,000 children and youth in need of permanent, stable, loving homes and connections. So in this episode, we're combining all of that and learning through the lived experiences of nurse and foster care survivor, advocate, and researcher about what's needed to make sure our foster kids are okay.
I am Dr. Sharrica Miller. I'm a pediatric nurse practitioner and nurse. I'm also a researcher and advocate, but most importantly, I am a foster care survivor. I'm the author of Verses, Lessons Learned from Foster Care, and I was also featured in a documentary called Still Waters Never Crashed, which chronicled my journey from foster care to PhD. I do a lot of things. I'm currently tenure track faculty in the School of Nursing at Cal State Fullerton, but my biggest and most important role is being an advocate and a researcher and a mentor for foster youth. And so my work is comprised of mentoring foster youth, advocating for legislative policy changes to improve the child welfare system, and ensuring their health and well-being as they transition out of foster care.
Sharrica, we're going to talk about mental health here, and very specifically youth mental health. By all reports, many children are really struggling, and that those struggles are significant. It shows up in our emergency departments, our schools, our families, neighborhoods, faith communities, in our health spaces. Being somebody who is a nurse practitioner who specializes in the well-being and the care of children, how do you share this information so that anybody can get a handle on the severity and the scales of what our kids are experiencing?
The kids are not okay. They are coming off of the heels of the pandemic. They were socially isolated for a while, And we're seeing a spike in anxiety and depression, in suicide rates, even suicide rates in communities that we traditionally did not see as high of suicide rates. They're not getting enough sleep. They are exposed to a tremendous amount of trauma on social media, a lot of trauma that is normalized, that is right at their fingertips, but they can't handle that. And not knowing how to communicate and have interpersonal relationships with other kids. They are struggling social and emotional developmentally wise, and just struggling to cope with the day-to-day challenges of them being children and adolescents. We're seeing this on a grand scale, and we have to do something about it.
Yeah. I mean, it's been so significant and such a sharp rise that the CDC came out and talked very specifically about teenage girls and their levels of depression and self-harm. Another one that really, I think, caught everybody's attention, the U.S. Surgeon General, came out
Yeah.
53-page report in looking at kids and their mental health and the stress and the anxiety. There are certain children who are at greater risk than others, and that's children in foster care. Can you talk about and describe foster care in America and the issues surrounding mental and physical health?
We have nearly 500,000 kids in foster care in any given year. And the most common reason they go into foster care is neglect. A lot of the general public thinks it's physical abuse. Some even think it is behavioral problems from the kids themselves, but the biggest reason is neglect. So we have these families that aren't able to care for their children. Sometimes the parents have mental health problems. Sometimes it's financial issues. There could be substance abuse. And overwhelmingly, the majority of foster youth are under 10 years old. So we're talking about young kids who are being ripped from the only environment they know. Even when that environment is traumatic, it is still familiar. And so when you remove them and place them in the homes of a stranger, that in itself is trauma. So you have the trauma of separation, the trauma of instability, the trauma of being placed with strangers that you're not sure whether or not they care for you. And so these youth experience a multitude of physical and mental health problems. And specifically mental health wise, we see that, of course, they are depressed and they are anxious and they are on edge because they're in this environment that is very unpredictable. They have this extreme loss of autonomy. Everyone around them is making decisions for them on their behalf, and they have little say so in that. So there's this feeling of powerlessness in addition to whatever trauma they entered the foster care system with. So if they were abused or neglected or witnessed interpartner violence or parents being incarcerated, now we have the additional trauma of them being removed and the additional trauma of them really being in this environment where they have no autonomy. In addition to that, there are issues with their parents of origin. So they're having conflict and they could experience sporadic visits, unpredictable visits. And so they deal with all of these issues, and that ends up with this cumulative effect of them having depression and anxiety and severe mental health problems that we see in these kids.
I'm just pausing, thinking about those kids for just a minute here. I'm glad that you mentioned that the ways that children enter foster care, and it's not always the ways that people think. We have had a spike in the number of children who have entered foster care through loss. I think that the most recent estimate from the CDC that there are over 200,000 children in the US. I'm not sure what the number is globally, who have been orphaned as a result of a loss of a caretaker, a primary parent through COVID. This is a set of kids who have had a significant loss where this foster care and foster families, that's their way forward. There is no going back to the parent of origin. Can you talk about children who are in foster care and not only in these new uncertain environments, but also in a place of profound grief from the loss of a parent?
Yeah, it actually reminds me of a specific foster youth that I know. We'll call him Kyle. And Kyle lived with his mom and his grandmother, and they were barely holding on, but they were stable at least. They lived in governmental housing. He went to school, he played football. He was about 12 or 13 or so when I met him. And so his grandmother passed away. This was the start of this cascade. It was really the grandmother that was keeping him stable and that was keeping him in school and going to checkups and things like that. So now that the grandmother passed away, the mother had mental health issues and substance abuse issues, and eventually they ended up homeless. And they were living back and forth in cars and shelters for a year or two. And then his mother overdosed and she died. And that was how he ended up in foster care. So he came into foster care now at 13 or 14, and by all accounts had lived a pretty traumatic life. However, it was all that he knew. And so now he has this loss of both his grandmother and his mother. And now he's in foster care. And he really exhibited a wide range of behavioral issues. He was very angry, very combative towards the foster parents. They diagnosed him with oppositional defiant disorder and ADHD and depression and anxiety. And a lot of this was exacerbated by all of these experiences. And so this kid that I'm referring to happened before COVID. But as you mentioned, there are a wave of individuals, and COVID came so unexpectedly. So you have these kids who, may have been in a similar situation where they were barely holding on, and then their only parent dies, and that's what places them into foster care, and in foster care in the midst of a pandemic, right, where court is being held via Zoom and social workers are doing phone calls instead of visits, and school is online in this whole world, and they're dealing with the grief and loss of their parent. And so that grief exacerbates those mental health issues, and I don't think we had enough targeted interventions and awareness specifically on how to manage that grief in foster youth who specifically were in foster care because of that.
Yeah, I'm absorbing this story of Kyle and and just knowing that there are hundreds, thousands of Kyles out there. In every single classroom, there is a child who is managing grief and loss and uncertainty in a new environment. Gosh,
And a new school as
yeah,
well.
new
Yeah.
school, new friends, new way of learning. It's no wonder. It is no wonder why there is so many mental health issues. Why this is surging, and it makes me wonder too. Again, as a researcher and also as a practitioner, somebody who is very immersed in all this. When you look at the rates and the causes of kids' poor mental health, it's changed over the last 20 years. What's the difference? What 20 years ago were causing mental health stresses? What's different today? What's causing the spike?
I think there are a few things. I think, of course, the easy answer is social media and the overexposure to trauma and the comparison, right, that they deal with. I think even economy wise definitely plays a factor in terms of how well families are able to care for children at home and manage kids at home financially. I live in California. I live in Southern California, very high cost of living. We have the highest homeless population. We also have the highest foster care population in California and in Los Angeles County. So I think we have to think about how the economy plays into that as well. And overall, families are struggling more. So the parents are struggling more with substance abuse and mental health issues themselves, not enough money to take care of the kids. And then we have this trickle down effect. And so there are a lot of different reasons why we have a rise in foster care and a rise in mental health in these kids. And it's kind of all happening simultaneous. That strain on the parents puts a strain on the kids. and can exacerbate mental health issues and be the thing that leads them into foster care, which just compounds it.
Yeah, all as you're describing that, you just see all of these things are linked.
All of
The
them are linked.
food insecurity and housing insecurity all lead to stress, which leads to mental health issues, which leads to families having all sorts of disintegrations. And it just leads right into foster care. And I just, when you were talking about the high numbers, that California has the highest numbers, and in 2021, what California listed was 47,871 children in foster care. I'd asked you to describe the foster care experience as somebody who's a researcher, as a practitioner. But I wanted to go to, a slightly different part about foster care. You're self-described as a survivor of foster care. And if you're comfortable with it, can you share the experience and the effect of, and let's call it what it is, the trauma of foster care from the lived experience, from the 12-year-old Sharrica, who was in foster care?
I think we would have to start with the 6-year-old Sharrica, and that's when I first went into foster care. And my entry into foster care was pretty traumatic because I went into a place called McLaren Hall. It was a former juvenile detention center that they converted into a residential foster care facility that is supposed to be short term, but ended up being long term. And there was also a mix of kids that had severe mental health disorders, kids that were violent, severe behavioral issues, and they would mix them in with other kids that did not have those issues and did not need those specialized services. And so I was coming into foster care because my mother was struggling with substance abuse, and my father was incarcerated, and there wasn't stability in the home. And I was placed into McLaren Hall, this loud, large residential foster care facility. And what I remember most are the kids crying and screaming at night. So they were these prison-like pods because, again, this was a juvenile detention center. So the kids would cry, and they would cry out for their parents. And I remember just dissociating myself from reality and sort of checking out from that experience. And so that was the start. And I spent the next 12 years bouncing in and out of foster care. So I dealt with a lot of instability because I did go back and forth with my parents. My mom would get sober. My dad would come home. They would take the parenting classes. They would get a place. We would live with them for 2 years, and then it would all fall apart again. I lived in several residential facilities. I lived in family care. I lived in traditional foster care, and it had an effect on me. One of the effects was just not trusting adults and initially struggling with interpersonal relationships and struggling with people who were in authority positions that I perceived weren't there for genuine reasons. So that was definitely a struggle. I struggled in terms of being separated from my family members, and that caused me to sort of live my life on edge, hypervigilant, and always hypervigilant for my stability to just come and get ripped away from me, even though now I'm an adult and I'm stable. It also caused some control issues because once I became an adult and got that autonomy and got control over my life, I held it so rigidly. And I think it just made me doubt that I could be successful and contribute to society in a meaningful way because of the negative perceptions that people have surrounding foster kids.
I'm so grateful for you. You've written about this. You've got a book, Lessons Learned from Foster Care.
Yes.
And The book description, it grabs you from the very beginning. Each year, nearly 500,000 youth are forcibly removed from their homes and placed with strangers in foster care. Once they become of age, the majority struggle with incarceration, homelessness, and drug abuse. But one woman beat those odds, and this book tells the incredible story of Dr. Sharrica Miller, the child of a drug addict mother and a dope-dealing father who survived 12 years of foster care and became a nationally recognized speaker, advocate, and foster care researcher. Part memoir, part self-help, Dr. Miller tells the stories of her childhood to convey relatable life lessons that will resonate with anyone who is trying to overcome adversity. And my goodness, adversity you have overcome and just channeled it into something that is so beautiful and important and helpful, and touching the lives of so many. So from those lessons that you've learned from foster care to PhD and really becoming that foster care advocate, can you walk through how you're taking your lived experience and really informing how to improve the lives of all children, but particularly those children who are in foster care?
Absolutely. When I went off to college, and let me just sidebar to say, I did not graduate with a 3.0 GPA from high school because I missed about 2 or 3 years of schooling throughout my elementary years, especially the times I was with my parents and we were homeless in tents and school was the last thing we even thought about. So I wrote my essay to Howard University and essentially begged them and told them the truth. Hey, I've bounced around. I've been unstable. This is where I'm coming from. My grades will reflect that. I had a lot of community service and was already working as a nursing assistant for 2 years and pretty decent test scores. And I think being a college that focused on holistic admission, that's what got me into Howard. And so I got to Howard. I completed the BSN program. It took me 5 years. And as we get to some of the solutions that these youth need, I didn't have any direction on how to pick classes. I didn't have a mentor. I didn't have, a path to follow. And so I struggled with getting through the prereqs and getting through the actual nursing program.
Yeah, I want to ask you a question on that one. So you get into college, you're at Howard, like there's any number of things that you can do. Why nursing?
Absolutely. So I did nursing assistant in high school out of survival. I needed money for prom and for graduation. Then my senior year, when I got accepted into Howard, and it was the summer before, my father was shot in a drive-by shooting and one of my brothers was killed. And we went to a hospital in Compton that was an amazing hospital with amazing nurses. And I just remember how they treated us. They didn't treat us like another gang-related shooting family. They took special interest in me when I told them that I wanted to be a nurse. So it was, what can I graduate with in 4 years and make a solid income to come back and get my brothers and sisters out of foster care and break that cycle? I knew I wanted to teach and eventually would go into teaching, but I wanted a career I could come out and make good money. So that was a big part of it as well.
Okay.
Yeah. Yeah.
Yeah. I was gonna say it's I'm as much as I know your story, hearing you share it, I'm so grateful for you. I am so grateful for you. All right. So you
Yeah.
finished up at Howard. You've got this nursing
I
degree.
finished up at Howard. I got my nursing degree. I came back home and I got custody of my two younger siblings who were still in foster care. So I had custody of them. They were living with me. Then I went back to school to work on my master's. And that's when I became a pediatric nurse practitioner. And then I rolled right into the PhD program at UCLA. So all during that time, I was doing community service with foster youth, but I never connected the two. And I think sometimes as nurses, we don't always connect our role as a nurse with the foster care system. We look at all these other vulnerable populations, but I feel like our foster youth sort of get ignored sometimes. And so even myself, I was working as a pediatric nurse and then completely separate from that, working with foster youth and mentoring them and working with organizations that promoted and empowered foster youth to use their voice to make legislative changes. So when I enrolled in the PhD program is when the dots connected for me. that I could conduct research on this population. And so my dissertation focused on the health and well-being of transitional age foster youth. And I looked at their rates of depression. I looked at their rates of anxiety, and I used the transition readiness score. So in other words, what I found was kids who were ready to transition as measured by this tool, they had better health outcomes, better physical health outcomes, better mental health outcomes, and better health services utilization patterns. In other words, they didn't just go to the emergency room. They had a primary care provider and got checkups and knew how to get prescriptions and things like that. And as expected, the youth who were not quite ready to transition into adulthood as measured by that tool, well, they were suffering and they were just running to the emergency room every time they had a cough, and they didn't even know they still had access to insurance. They didn't know how to get a prescription, how to make an appointment. And so this really showed that we can find these kids as providers, we can find them in the clinics, and we can use tools to assess their level of readiness in order to sort of capture them and provide them with some support and resources as they transition into adulthood. So that's sort of how I found my way into the research and advocacy world, and connecting to the two dots as a nurse now, and using that to tackle issues in the foster care system.
Share more about some of the programs and some of the advocacy work that you've been doing that your nursing research and your nursing practice is really informing and guiding.
Early on, I was very involved with California Youth Connection. And what's unique about that organization is that each local chapter is comprised of current foster youth and former foster youth. And so the older former foster youth sort of buddy up and mentor the younger foster youth, but the group is set up with youth empowerment as the focus. And I think that's what organizations have to do. And so the voices come from the kids who are in foster youth. And our overall objective of that specific organization is to advocate for legislative changes. And once a year, we have a day at the Capitol where we take all the foster youth up to Sacramento and they tell their stories and they learn the powerful art of storytelling, because a lot of these politicians and legislators need to hear, they need to know firsthand what happens in foster youth. And we have a saying in that organization, nothing about us without us. And I think that other organizations can learn from CYC in that it is youth focused, youth empowered, and the adults, we sort of take a back seat, but the majority of the adults are adults with lived experience. And so we're all speaking from experience and showing the youth how to really make changes and how to use their voice and their personal lived experience to really highlight the changes that need to be made. I think that we're doing a decent job of having the youth sit at the table with the solutions, but it's also important to have the youth sit at the table and discuss what the problems are. So that's one organization. Another organization that's really prominent in California is Guardian Scholars. And so Guardian Scholars is a program at most universities where they provide resources and support to foster youth. So, for example, housing is a challenge for foster youth. And when I was in foster care, I did not have housing all the time. And I was just in the general lottery of students who were fighting for housing. But when you're in Guardian Scholars, these type of programs give priority housing registration to foster youth. So just something simple as that. Another big issue is that college campuses would close down over Christmas break.
Yeah.
I was literally homeless during those times. I was couch surfing with friends. And so having it to where the resident halls stay open for the foster youth so that they can stay on campus is another simple way to address their needs. And so this Guardian Scholars program, particularly at the university where I teach, which is Cal State Fullerton, has an amazing model. They have mentors for them. They provide them with laptops and financial support. They all house them together. They are helped in terms of priority registration for classes, priority housing, support for transportation, clothing, books, etc. And I've been part of that organization. And what I have definitely been instrumental in doing is creating a collaboration between nursing and guardian scholars. Why aren't we as nurses more connected to this organization here on campus that is serving arguably some of the most vulnerable students here on campus? And so one of the things we did was this yearly fundraiser and foster care awareness day right during May. So what we did is we did it right during Nurses Week, and that like first kind of second week in May, and then May is National Foster Care Awareness Month. And so leading up to May, we raised funds and we collaborated with the organization called Foster Love, and we purchased duffel bags. And do you know the significance of duffel bags in foster care? Why it was so important to purchase those?
Because you got to have a place to have all of your stuff, because you never know when you're going to have to pick up and leave.
Yeah, and what foster youth most often use to transport their things are trash bags. Exactly, trash bags. And trash bags, there's no dignity in that. Yeah. And I grew up as a teenager, and I would spend the night over my friend's house and tie my clothes in a plastic bag. And she's like, "Why didn't you just use your backpack?" And I'm thinking, people put clothes in backpacks, right? So this organization geniusly, right, has duffel bags. The duffel bags are amazing. So on this day during Nurses Week, we decorate the duffel bags. And I would have my students come. I would have members of the community come. I would have all the nursing faculty come. And I've also reached out to members in the community. So I would go to dental offices and get toothbrushes. I would go to Dollar Tree and get toiletries. And we would stuff all the duffel bags with all of these different toiletries, as well as letters of encouragement and empowerment that we will all sit down and write together. So it was this huge day with all of these facts posted around and people writing these inspirational letters and decorating these bags and stuffing them. And then I would take them to the same foster care facilities that I used to live in. So a very powerful full circle moment for me. And what this did was brought awareness to the needs of foster youth and brought on more nursing faculty to serve as mentors for foster youth, and to also understand how we better support them as students and understand their unique needs as students. And that when we get lucky enough to have a nursing student who is a former foster youth, that is a powerful thing. And we need to make sure that we provide them with extra support as we are doing other vulnerable student populations.
And Sharrica, you've been so generous and courageous and vulnerable in using your story to raise awareness and to educate everyone who touches the child welfare system on how to support youth, foster youth and families. And you do it through your writings and your practice, and also through a documentary film featuring you, Still Waters Never Crash. I want to play a clip from the film and then talk about your plans for this project. So in part of this clip, you're standing by a roadside motel at the intersection of Century Boulevard and Prairie Avenue in Inglewood, California. Cars are rushing by in the background, and you're describing to the film crew the time in your childhood when you would move from motel to motel with your mom and your brother. Let's have a listen.
I think what I remember most about my childhood was the degree of instability. I stayed in probably 8 different motels on this whole block, like down Prairie, down Century. And it was normal to me to be bouncing around from motel to motel. And this one is probably one of the main ones that I remember, because we would stand here one time and it was just my mom, me and my brother. I guess we didn't have the money for the room, I don't know. We was trying to meet up with her sugar daddy, something was going on. You know, we kids, we don't understand the full magnitude of it. And they put our asses out. They put us out, and basically my mama made a little pallet for us right outside the room door, and me and Raymond slept right there. And she went, did what she did, hustled up some money, we came back and moved to another motel. Yeah. Some shit you just don't forget. It wasn't all bad memories. It was actually a lot of kids, a lot of families that stayed in the motels. It was like a motel-like culture. So this one didn't have a lot of kids. The one next door had a gang of kids. If they had a pool, it was always families, kids. So, you just woke up, and we weren't in school this whole period, probably for like a good year or two. This whole time we lived here, next door, all them different motels, we were never in school. So, and no, I didn't see the other kids was in school either, because we would wake up and go outside and play with them. And we just was out, unsupervised.
Wow. Watching that, listening to that, it's powerful. It's a lot to take in. So, what are your plans for using the documentary?
We were doing screenings, and then I got a little overwhelmed with it, just seeing your whole life play out on camera. The last screening we did was for Nurses Week and National Foster Care Awareness Month on my campus. And we hosted a panel discussion. We had Guardian Scholars involved. We have foster youth as volunteers, a whole production. So now what I'm actually looking to do is build a curriculum around the documentary and then license it out to universities, to child welfare programs, nursing programs. We can use that story to help train individuals in a way that is engaging and meaningful and impactful. So absolutely, that's the goal with the documentary.
In March of 2015, Harvard's Center on the Developing Child released a study offering the profound yet simple insight that children who do well, despite serious hardship, have had at least one stable and committed relationship with a supportive adult. I invited Sharrica to explain the research and its importance for kids in foster care. Say more about that research. I mean, I love that phrase that, every kid is one caring adult away from being a success story. I love that tagline from the Harvard study, but say more about what we know from this research.
Yeah, we know that connectedness is a very powerful tool, and that when youth are in foster care, having one adult that they can feel connected to has a tremendous impact on their overall well-being, as well as their ability to succeed into adulthood. And that's why programs like CASAs, Court-Appointed Special Advocates, which is one person that is there to advocate on behalf of the foster youth, no matter where they transition from home to home, is very important. And I think that kids having that one person that they know they can rely on can help counteract the instability that they are experiencing. And there's an organization that I've been fortunate enough to volunteer with and partner with called Kids in the Spotlight. And so what they do is they use filmmaking is their way to connect with the foster youth. And they provide all of these amazing opportunities for foster youth to work with individuals who are in the film industry. And they create films and short stories. Right now, they're working on a film on the over-medication of foster youth. It's us telling our own stories, but it's more than that. When you keep kids in extracurricular activities, it does so much for their well-being, their life skills, their discipline, their focus. It gives a chance to nurture their passion and empower them and raise their self-esteem. And so I think sometimes when we're looking at solutions in mental health and well-being and foster youth, there are a lot of things that we can do, right? Medical-wise and system-wise, et cetera. But there are also some low-hanging fruit, such as if this kid plays football, and you're bouncing them around home to home, are we thinking about them still maintaining their ability to play football or play guitar or be in film? And are we nurturing their passions so that they can thrive in adulthood? Or are we simply setting them up for a state of survival? Because when you transition without a plan, without a passion, without a path, without an adult that you can call and who will help nurture and empower that exacerbates your anxiety. That makes you more depressed. I wanted to play basketball so bad when I was in foster care. I wanted to do karate. I remember my brother and I would, quote unquote, I'm using quotes, air quotes here, take karate. And what we would do is stand outside of a karate studio and just do what the kids were doing. I mean, so I wanted to be in some activity so bad, but it wasn't a priority for the foster parents, or they didn't have money for uniforms, or they weren't going to pick us up after school. And so these are ways that we can help address the mental health needs early on by keeping them connected and focused.
You'd mentioned taking kids to meet with legislators. I think it'd be really helpful and important to explain the legal structure and the funding structure for foster care. Because a lot of people, they hear foster care, mostly they're going to hear it at a local and at a community level. Can you walk us through how the foster care systems in this country are structured?
So in general, foster care is federally funded through the Social Security Act. And so there are different funding structures that are separated by state. So that's one big thing, is that each state and then each county sort of gets to decide how to disseminate the foster care funds and in what way the pay structure is set up. So for example, in California, each foster family could receive monthly anywhere from $1,000 to up to $2,500 per foster youth. And that's dependent on a number of factors, such as whether or not this foster youth needs intensive care, whether or not they have behavioral issues, medical problems, etc., that could increase the amount of stipend that the foster parents get. And so what that results in is a disparity in outcomes across states and across counties, because we don't have one centralized way to do it. And in some ways, that's beneficial because we have specialized populations and special areas that need targeted interventions. But in other ways, that creates a lack of accountability and oversight in terms of the outcomes. And it creates this structure where the behavioral needs and the health needs of the child, it's just reinforced because we know that we can get more money if this child continues to demonstrate mental health needs. And so we don't have a strong incentive to therefore treat those sort of things. And so those are some of the funding challenges that we see with foster care. And there's 3 different types. Individuals can go into traditional foster homes with the foster family who's receiving a monthly stipend. They can go into residential foster care facilities that are staffed by individuals. And so the entire facility is receiving the funding. And then there's kinship care, which is definitely one of the biggest gaps, because this is when families are placed with kin. But a lot of times the funding isn't equivalent, and that creates significant issues. So for example, when I had my 2 younger siblings and I was working as an RN, I didn't receive any funding for them at all. So when they were in foster care, the foster parent was receiving $1,200 a month for them. But when I got them, it was my responsibility to pay for their food and pay for this and pay for that. So it doesn't create a system where you would want to keep families with kin. It doesn't create a system where families would want to take in their relatives, because the funding structure is problematic and it's uneven. And it's also dependent on the type of foster care that the child is placed in.
All right. So can you take us to some of the things where systemic changes need to be made to improve the health and well-being and the happiness and stability of children? Yeah.
Yeah.
So that they can go and pursue karate. They can be on that. They can be on that football and basketball team.
Yeah. And I think for that to happen, there does need to be policy change. For example, I am part of the LA County Roundtable discussion group, and we are looking at what type of policies and guidelines do we need to ensure the health and well-being of foster youth. And one of the things that we're looking at are those extracurricular activities, and how can we ensure that foster youth have the right to pursue those type of activities. And it doesn't seem like it needs to be right, like this big law and this big legislation, but it does need to be mandated. Another big bill that we worked on that was passed recently was a sibling bill. And so that was to ensure that foster youth had contact with their sibling, physical contact with their sibling, at least once a week. Again, these are things that you wouldn't think need to be a policy or legislative change, but they did. So there's not enough mandate for foster youth to undergo independent living program training. And there needs to be more funding towards that, more funding towards the program itself, but also more funding for stipends for the kids. I only went to my independent living program classes because I was getting a stipend. Then I later found out that other kids from other counties weren't getting a stipend, and so they didn't go. Those classes taught me important things about mental health, physical health, financially, how to take care of myself. I think there also needs to be funding and legislation around not just college. So we're doing very well with college, but not every kid wants to go to college. Some want to play guitar, some want to go into film and art and music. And so vocational training and more non-traditional routes to success is also an important part of addressing the mental health needs. And so what we see is that it's not just the mental health needs, right? That we have to ensure that the child is able to thrive and feel whole before they get cut off from the foster care system and sent off into the world alone. Now, in most states, foster care is extended until 21. And we do have strong research to show that kids that stay in foster care longer, they do better when they are emancipated. And so part of the work that I've been doing with Arizona Supreme Court is working with their child welfare practitioners, doing workshops and facilitating trainings to help them better engage with foster youth and teaching them very concrete strategies for how to connect with foster youth and how to have a youth-led relationship. Also working with nurses in the hospital setting. So I've been doing these classes called Care of the Hospitalized Foster Youth because I think sometimes nurses aren't well versed on the child welfare system. So we have social workers who don't really understand the health needs of foster kids. And then we have nurses who don't understand the child welfare system. And there's a gap, there's a disconnect there. And so I try to bridge that gap on both sides by working with the nurses who are taking care of foster youth, helping them understand who can consent. How do we support reunification? How do we support the connection between the biological parent and the child and the foster parent? And then working with child welfare practitioners. And how can we ensure that that child is receiving regular checkups, helping them understand why it's so important for them to have one provider, one mental health care provider, one stable adult in their life, supporting their extracurricular activities, etc. Another thing nurses can do is nurses are primed to become foster parents of medically fragile children. And so I think more nurses should consider being a foster parent because we can take this very specialized population that is often neglected because if they have a G-tube, if they have developmental needs, there's going to be less foster parents who are willing to take them. And then lastly, I think nurses have to be aware that their advocacy efforts and their advocacy skills go so much further than the bedside. And we have privilege as nurses. We have a platform and a voice that people trust and they listen to. And so all of these organizations like California Youth Connection, Kids in the Spotlight, we can all be part of those organizations. And it doesn't have to necessarily do with our nursing skills, but rather our skills as advocates, as leaders, as change makers, and as policy makers as well. So I think we have to think about in what ways can we serve these youth away from the bedside and ensure that their overall well-being is protected.
I want to go back to a comment that you made about, nurses are very good at identifying communities that need care. And for some reason or another, we don't name foster children. We don't name them. And I think a lot of that is because oftentimes they're not allowed to speak for themselves. Decisions are made for them. They don't have agency and autonomy. And so when you don't have a voice, it's very hard for people to know that you exist. And I love that you have been so courageous in sharing your story and not only being a voice and an advocate, but also carving out a a professional practice that says, here's a community that needs a whole lot of love. And who better than nurses to be that connection point, to really see the connection between. And, you're a pediatric nurse practitioner. You've been working in a lot of the acute and the clinical care settings. But I am thinking about our public health nurses, our school nurses, so many nurses who are out in the community where taking this as a specialty and a discipline and a community to really pour a lot of attention, research, evidence, love, support, care towards.
I think that nurses should be at the forefront. Nurses need to collaborate with child welfare practitioners and work together. So right now, or as it was traditionally and historically, when deciding what should be done about the healthcare needs of foster youth, it's coming from the child welfare side a lot of the time. And so they are deciding how it should go, when they should get checkups, et cetera. But nurses have that knowledge. And so I think nurses need to be at the forefront of that. So for example, keeping the kids' medical records intact, huge problem. And so now we have organizations such as Health Passport, where foster kids, no matter where they are in California, can have all of their medical records, physical health, mental health, as well as their school records, all in one place, right? Keeping up with immunizations, always a problem when enrolling in school, definitely was a problem that I faced when I was a kid that kept me out of school. And so together with the nurse manager, we helped create the policies for what would happen when a foster child was hospitalized in that hospital. So nurses should be right at the forefront of making those decisions and helping to shape how we care for foster youth.
Well, I love that while you were practicing and taking care of kids, and then over on this other side of life, you were advocating and volunteering to take care of kids in foster care. I'm glad that all of a sudden the light bulb went on. Yeah. Because I think as we're having this conversation, more and more people are going to hear that connection and say, yeah, that's where I want to take my practice. And I think of you as somebody who's really been not only a survivor, but a thriver and a leader. And I cannot thank you enough. I understand that your mother is doing well. Tell us about your family.
Yeah, so there were 5 of us in terms of siblings, and we are all doing well and thriving. My brother is also a nurse practitioner. He is working on his DNP. I have a sister who is an LVN, who is now enrolled in her prereqs for RN. I have another sister that has a very successful professional development company, and I have another brother who works in property management. And so we all made it out. I had custody for some of them throughout the time, but we have a saying in our family that the family saves the family. My mother did end up getting sober after 24 years of heroin. She's now been sober about 12 years. She is a successful business owner in Arizona, but more importantly, her business, which is a boutique, part of her proceeds and her services and her philanthropy work goes towards specifically helping mothers who have lost their kids in the foster care system. I think people automatically have this perception of foster care as being like dark, you know what I'm saying, and just this miserable experience, but it wasn't always like that. Together as a family, we are very transparent and vocal about our story, and we try to use the privilege that we have of being survivors of the system to help advocate for other families. And I want to say one other thing too, which is that I've kept in contact with one of my foster parents, Brenda, who was a very special foster home that I lived in. As I was writing the book and filming the documentary about my experiences from foster care to PhD, we had an opportunity to reunite with Brenda after about 20 years. And it was a special moment with myself and my mom and my daughter. Do you know where we're going? You don't remember whose house we're going to? Brenda's. Yeah, Brenda's house, yeah. The point of this story is that one thing Brenda did very well when I was in foster care is she nurtured the relationship between myself and my mother. She supported the reunification. She empowered my mother to get sober. She always believed in her. She never tried to take her place, as a mentor and as a foster parent. And I always had that connection with her. And she was a big part of why I was successful, because for the first time in my life, she gave me the opportunity to just exist as a normal child and not have to survive. And so I think we can learn a lot from that power of connection, of community, of empowering these parents who are really struggling and trying to keep the families together. And that will help address the mental health needs of the kids. Come on up. We at Brenda's house. We're going to knock on the door and say, good morning, Brenda. Hi. I want to cry. Look. I'm just crying. You do? You look exactly the same. Oh my God.
Wow. Hi, little sweet mommy. You're beautiful.
Yeah. Do we need to take our shoes off?
I'm so proud of you guys.
The film Still Waters Never Crash. I love the subtitle, One Woman's Resilient Journey from Foster Care to PhD, and surprising her with that visit. That is pure joy. Overcoming so many obstacles where the odds are stacked against you, a lot of hard things. And I'm so grateful that you were willing to share that story. So yes, making a film, writing a book, getting a PhD, changing your practice, advocating, the image that you have behind you, a shape of a heart made by a family of hands. It does speak volumes. And like you said, the family heals the family.
That's
family restores the family. So all of those things, again, just thank you so much. And I just want to tell you how much I love you. I'm so proud of you. And I love you.
Thank you so much. I appreciate it.
She makes such an impact on my life. Brenda took my kids in as foster children in the middle of the night, and she took them all. She got through 2 of them first, and she went back and got another one. She went back and got another one so she could keep my family together. She insisted that my children have grandparents, uncles, and aunts, her family. She shared them with mine. The social services said I wasn't fit to see my children. I wasn't fit to pick them up, but Brenda never said that. She wanted my children to have that connection with me, and she never degraded me. She was very powerful in our lives, you know what I mean? I was really sad that my children ended up leaving her. So when Sharrica called me and told me, you will never believe who I found, I didn't believe it. I said, I'm getting in my car and I'm going to come there because I want to see this woman and I want to thank her for what she's did for my family. I think it was so important. So it was so crazy because we were so nervous, and I was so nervous last night. I literally went somewhere and bought like 12 outfits because I didn't want to, I wanted to come and I wanted her to see me and I wanted her to know that I'm all right now. You know what I mean? And the seeds that she planted, I was able to pick them up with my children, and we were all able to grow. I appreciate you taking care of my kids.
I know it. I know it. We was a family. I was your family too.
Yeah, you were.
We all stayed a family, and that's the way it's supposed to be.
A heartfelt thanks to our episode guests, Sharrica Miller, to 6-year-old Sharrica, to foster youth Sharrica Miller, to college and PhD graduate Sharrica Miller, to pediatric nurse practitioner and foster youth researcher and advocate Sharrica Miller, and to our guests who radiate hope, love, and inspiration to foster youth, foster parents, and families everywhere, Sharrica Miller and her extended family. For See You Now, I'm Shauna Butler. Thanks for listening.
Nurses are transforming healthcare through innovation, compassion, and leadership. And Johnson & Johnson is proud to continue its 125-year commitment to champion nurses through recognition, skill building, leadership development, and more. The American Nurses Association is dedicated to building a culture of innovation. Nurses improve the lives of patients and communities through innovative thinking, empathetic connection, scientific rigor, and sheer determination. ANA is proud to support and advocate for our nation's most valuable healthcare resource, our nurses. For more information on See You Now and to listen to any of the earlier episodes in our library, visit seeyounowpodcast.com.